Hi, we're back at part two of the risk factors in stroke and heart disease, and we're here with Dr. Eileen Stoller. And so perhaps we can continue with diabetes. That's a risk factor.
Absolutely. Thank you, Bob. Diabetes is a big risk factor for stroke because of several factors. One is that poorly controlled diabetes leads to laying down of additional fatty material inside the blood vessel. The blood vessels lose the ability to move, they lose the ability to be soft and compliant, and they become stiff and rigid, which makes it much more likely for some of that fatty stuff to break off inside the vessel and travel through the circulation to the brain. Thirdly, it also, when you have high sugar, sugar acts sort of like a cobweb, and it forms these little sticky webs of sugar in the blood. And that causes some of the cells to get stuck in that sticky web and actually increases the likelihood of developing a clot. So uncontrolled or poorly controlled diabetes is a big risk factor for stroke and other kinds of cardiovascular heart disease.
Type 2 diabetes is, again, a lifestyle issue
Exactly.
in most cases.
Exactly. Type 2 diabetes comes with age. That's why they used to be called adult onset diabetes. And it also is very, very likely to coexist with obesity or big overweight. And that's a major consideration for stroke also, for several reasons. First of all, if you're overweight, you have a lot more body to pump blood to. So your heart is working harder, and it takes more and more pressure to do that. If you are overweight, it also is probably an indicator that you're not going to be very active, because inactivity is one of the major risk factors with stroke. It's said now that inactivity and sitting at a desk is the new smoking. Smoking is bad, and we all know that, and everybody's aware of that. But now people who have given up smoking but sit at a desk for 5, 6, 7 hours a day have just as much risk of having heart disease and stroke as they did if they had been smoking. So it's imperative that you get up and move around. It's recommended that you have at least 10 minutes of moving around every hour to an hour and a half during the course of the day if you're working. It's also imperative that you have some activity going on. It's recommended that you have 150 to 180 minutes of activity a week, which really, if you look at it, it's 30 minutes a day for 5 days a week, pretty much.
But you don't start with that necessarily. You can start with a little bit, because that sounds like, even though it sounds relatively little, it is actually quite a lot when you haven't been doing anything.
Exactly.
So I recommend that people start, and that's what I did when I was in the wheelchair, and I took a minute or two. That's all I did.
All right.
And then it was 3 or 4 minutes, and then it went on from there.
Right. And if you look on the internet, you'll see all sorts of chair yoga and things that you can do while you're seated in a wheelchair or just sitting at home, if you can't get around, that you can start being active and you work your activity up.
Or in an office. Someone
Right.
can do that exercises, little exercises in an office. You're on a conference call, you do something. Doesn't mean you don't listen, but meanwhile you move yourself.
Absolutely. Very good point.
Yeah.
And the other thing, too, is you have to think about where you are. One of the problems we see here in Southwest Florida is people come from the Northeast or the Midwest. They fly down here, they get here. Within 24 to 48 hours, they wind up in the hospital emergency room with a stroke or a heart attack. And one of the big problems is when you're sitting on an airplane, you are a captive audience. You're sitting there, your feet are down, you have dependent edema. If you take your shoes off at the beginning of the flight, you often can't get them back on when you get to land, because all of that fluid stays in the lower part of your legs because you're not able to get it back up the veins because you're not moving around. So it's pooling in your feet, you're developing clots. You're also dehydrated because you generally tend not to drink very much because you don't want to get up to have to go to the restroom. And also there's not much humidification in the cabin air of airplanes. So it becomes extremely important, if you're going to fly, to move around, move your legs, even if it's just doing circles with your ankles and changing your leg position frequently so that you don't develop those
That's what my
clots.
wife does. She does circles.
Right, exactly. You can just wiggle your
Right.
feet around and
It's
move
tough to
around.
do in these
Well.
these airlines now. We barely have room to get in.
That's
Get
very
into
true.
to the aisle.
Sometimes it's hard to breathe in and out in the
Right.
space you're allotted.
Right.
But anything that you can do to help and stay well hydrated, that's the other thing. And alcohol is the most dehydrating thing you can do. So basically it should just be water.
Yeah. Well,
But-
sometimes.
Yeah. But obesity or overweight and activity are two of the things that will go a long way towards reducing your risk, along with keeping your blood sugar under good control. Okay? Now, I have to warn you here at this point, there are lots of different exercises that you can do, but jumping to conclusions is not considered to be an exercise. So you really can't count on that one.
Right.
Another big risk factor for stroke is a heart arrhythmia called atrial fibrillation. And that's where the top part of the heart, which are the little tiny chambers, don't beat normally and push the blood down to the big part of the heart. They just kind of quiver. And when they quiver, the blood stays in there and it becomes turbulent and moves around. And little clots will form. And then, for some reason, the heart just goes back into its normal rhythm. Those chambers contract and they push those little clots out. And those clots can go to your lungs, it can go to your heart, it can go to your brain and cause a stroke. So when people are diagnosed with atrial fibrillation, they need to be really careful about certain things. And the major certain thing is that they are probably going to be put on an anticoagulant or an antithrombotic like aspirin or Plavix to decrease the collection of clots in the atrium. We know as people get older, they have more tendency to develop atrial fib. We think it has to do with the fact that as you age, the electrical system in the top part of the heart just doesn't function normally, and it sometimes skips beats or causes the fibrillating.
Yeah, one of my coaches had atrial fibrillation. He passed away recently.
Oh, wow.
But he was having a lot of these beats.
Yeah.
Exactly.
Exactly.
Inconsistent beats.
Yep. And sometimes some people actually feel the fluttering, but the vast majority of people don't. So again, you're not really aware that you have it unless you go for the physical and you have the EKG and it's seen on EKG. But the big important thing there is usually one of two things will be done. They'll either try and treat it medically with a medication that will change that, or if they can identify an area in the heart that's abnormal, they'll try and treat that with something we call ablation. But barring that, if you're not going to have that, if you decide you just want to, learn to live with it, you will be put on some sort of blood thinner, whether it's Coumadin or the newer blood thinners or aspirin or Plavix, whatever your risk factors determine you need to be on. And you need to stay on that, because the worst thing you can do is go off of that medication without consulting somebody. That initially raises your chance of having a stroke very, very much.
And Eileen brings up a very important point. So many people, whether it's financial or side effects or some other reason, they just on their own stop taking their prescriptions. And that becomes a significant risk in their life. And so those are two more risks. And thank you very much.
Thank you very much.
And we'll be back again for another session.